Bariatric surgery is a weight loss surgery in which you can lose weight for a long term. Now, what are the different types of surgeries? We have the sleeve gastrectomy, the banded sleeve gastrectomy, the gastric bypass, the banded gastric bypass and the mini gastric bypass, which we use in India, which suits our population, which suits our patients, our diet. Now, how do we prepare a person for this surgery? Once a person decides to undergo this surgery, there are certain points to qualify. One is the BMI. Based on your height and weight, we have a calculation by which we get our BMI. The BMI should be more than 37.5 if you do not have any other associated problems, and then you can qualify for a bariatric surgery. If you have associated diabetes, blood pressure, high cholesterol or knee joint pains, infertility, sleep apnea, then even with a BMI of 32.5, you can qualify for this surgery. Now, once you decide you want to go in for the surgery, there is a list of blood tests which we need to do. Why do we need to do these tests? Because we'll be restricting our diet for a very long time, which is a period of about 4 to 6 months, maybe around 8 months also. So we need to know that our vitamin stores, our calcium, iron levels in the body are absolutely fine. Our kidneys are functioning well, our liver is functioning well. We do a detailed heart checkup. And we also do a venous Doppler for our legs, for the veins in the legs, to make sure that we do not have any clots in the legs also. So once we do all these tests, we ensure that we are fit for surgery. Once this is done, then we put the patient on a diet. Now you'll be wondering, why do we need to put a diet on a patient who's just going to undergo weight loss surgery? This is because in the obese, the liver size is enlarged and it is a fatty liver. So we need to make the liver soft and supple before surgery. This will help us during surgery, make surgery much easier. What do? We put them on very low calorie diets or low calorie supplements. We tell them to avoid fried food, avoid rice, avoid all sweets during this period. Now this period varies from person to person. If a person is just morbidly obese, that BMI around 37-40, then this period of diet should be for around a period of a week or so. If they are above 40, between 40 and 50 the BMI is, then we put them on a diet for about 10 to 12 days. And if they are super obese, that is BMI above 50, between 50 and 60, then we need to put them on a diet for at least 15 to 18 days. Once this is done, we also make them go on to breathing exercises. We call it the incentive spirometer is used. This is a tribal test in which these breathing exercises help them to increase the lung function. If they do this breathing exercises well and go on to a good diet, this surgical outcome is extremely good. So much so that on the same day of surgery, 6 hours after the completion of their surgery, they are able to take at least 10 to 12 steps with assistance. And from the next day onwards, very next day, be it a 100 kg patient or a 200 kg patient, they are up and about. They can walk on their own, they can climb steps, get down steps, all independently. So what are supplements that we take after a bariatric surgery? We need to supplement yourself iron, calcium and vitamins. This needs to be taken for a period of 1 year if you are undergoing a sleeve gastrectomy, and lifelong if you are undergoing a gastric bypass. Why lifelong? Because we are bypassing that part of the intestine where most of these vitamins and minerals are absorbed. That is why, to remain healthy, we need to take these medications. Now, once we have done these tests before surgery, 6 months after surgery and another 12 months, that is a year after surgery, we repeat few of these vitamins, and this helps us to know how we are doing and whether we need to take some injectables or some additional medicine. Now, what are the precautions? Like you may say, does bariatric surgery have any side effects? Yes, there could be some side effects if we don't follow what your doctor tells you. Like after the surgery, your eating habits change. Prior to surgery, you take big morsels, you don't chew your food properly, you hardly chew twice or thrice and you swallow it, and we eat very fast.